On June 26th, 2022, Docs4hair proudly hosted its first Zoom live town hall. The topic of the meeting was how to style your hair while dealing with alopecia. The Zoom live town hall was presented by hair loss experts and hair restoration surgeons, Dr. Achama Osetutu and Dr. Meena Singh. The meeting also featured a global panel of dermatologists and hair industry experts. Listen while each shares their experience.
My name is Ncoza Dlova. I'm a full professor of dermatology as well as a chair of the dermatology department at the University of KwaZulu-Natal, Nelson Mandela, Durban, South Africa. I'm also the dean of the medical school. So we're doing a lot of research in this section, and I must say that what we see mainly is alopecia, but what is sad to see is the fact that the prevalence age for tractional alopecia is getting younger and younger. And the youngest patient I have seen with tractional alopecia is 4 years old. And nothing else explains this except the fact that now young girls are putting extensions, synthetic hair on their hair because they want to have long hair, and now are seeing tractional alopecia at a much earlier age compared to the prevalence that we used to see around middle age. And this is a concern because tractional alopecia is literally an iatrogenic condition, is self-made, it is a preventable that if all of us were to be aware and the hairstylists have to be taught, we could prevent it. The second challenge that we see is dandruff or seborrhea, itchy scalp. And again, this is explained by the fact that most patients do not wash their hair frequently enough. There's a study that we've just conducted in partnership with L'Oreal, where we looked at the concentration of microbiomes on the scalp to see whether it is related to the severity of dandruff. That's just been submitted for publication. Hopefully, we'll be able to access that pretty soon. The recommendations really for washing hair for afro-textured hair is at least once a week, and that should keep the dandruff away and the symptoms of pruritus or itch away. The third thing I want to talk about is frictional alopecia, which is a problem associated with use of wigs and weaves. Someone mentioned this here. Was making recommendations in terms of the level of attachment of these prosthetics. It's a problem that we see because of the lace and the roughness of the elastic and pressure. We're seeing it around at the back and on the frontal area. Fifth problem that we see, which now seems to be superseding CCCA. If you look at the epidemiology, the most common cause of hair loss in African patients or patients of African ancestry is fractional alopecia, followed by CCCA. That was the last I was reading. Cause, although this is anecdotal because we're conducting a research right now looking at about 200 patients, it seems like opposing alopecia, which is a form of lichen planopilaris, is now going on to number 2 in the race in terms of prevalence of hair loss. And this is something that is worrying and concerning us. There's some studies that have shown that it could be related to sunscreens, especially this was a paper published by Messenger from the UK. It sort of puzzled us because African patients don't use as much sunscreen as the Caucasian patients in other countries. So we published about 10-15 cases of patients who developed a type of eczema on the sides of the neck. And this was happening in patients with a background history of atopy, meaning these patients had either asthma or atopic eczema or allergic rhinitis or conjunctivitis. And we found that they presented with the lichen simplex chronicus, for the hairstylists that are here, it's a patch of eczema around the neck. And they noticed that once they remove the sick hair, be it the wig or extensions or weaves, it disappears. So we did patch tests to see whether it could be allergic reaction due to the dyes and the glues, etc. But the patch test was negative and the use test was positive. We also did a patch test to standard battery on all the hair series. They were all negative. Included that the eczema, which was triggered by the use of tensions or in the form of wigs or weaves, was an irritant contact dermatitis. And the take-home message was patients who have a history of atopy or eczema or sensitive skin should avoid wearing synthetic hair. Another study that was conducted by a colleague was working for L'Oreal also. They looked at the impact of synthetic hair causing fragility on the hair shaft. And they found that when you actually tie the synthetic hair, when you're plaiting the hair, where there's contact with the natural hair and the synthetic hair, you get a fracture in that area. And we all know that African hair tends to have coils, knots, and that actually worsens that condition. And the recommendations were that synthetic hair on your natural hair, it should not be more than for 1 month every 6 months, because that actually breaks the hair. Thank you so much. And if there's anything else I'd like to ask, please feel free to post on the chats. Thank you.